Hi, Wiley Long with HSA for America. I want to talk to you a little bit more about the public option. So I spoke previously about the public option and why some members of Congress feel so strongly that they should be part of any health care reform proposal. And it is clear that their main purpose is to ultimately have a single-payer government takeover of the health care industry. But let's ask ourselves, can the government fairly compete against private industry while at the same time regulating that industry? Well, we know that a government option would be exempt from many taxes that private companies have to pay. The current proposals, they've thrown out numbers of $2 billion in interest-free funding for the private option. Private company, or for the public option rather, but of course private companies pay interest on any money they borrow. The public option is also set up to underpay healthcare providers by 20 to 30%, similar to how Medicare does that right now. Well, the result of those underpayments is that private individuals and private insurance companies end up making up the difference. Okay, so naturally, if private companies are paying higher reimbursements, and even higher than they otherwise would because they're having to make up the difference that the public option doesn't pay, then clearly we create a situation that puts the private companies at a strong disadvantage and is really structured to eventually put them out of business. So the private option is bogus. It's not really structured to increase competition. But increased competition would be a great thing. So how could we promote that? Well, one, we could allow companies to sell across state lines. So for instance, here in Colorado, there are hundreds of plans available. Somebody in New York, if they could choose a plan that was based out of Colorado, well, they could probably find a plan that would cost less than half of what it costs them right now in their home state. So maybe another option is to eliminate state regulation altogether and have one national market for health insurance and watch the competition and the insurance companies come out of the woodwork to compete for that business. So those are just a couple ideas of how we could really increase competition. The public option, unfortunately, as good as it sounds on the surface, is a way to ultimately decrease competition and create a government monopoly for health insurance.